I'm assigned to Region 1. So for those of you who are not familiar with the regional model, I cover Clackamas, Clatsop, Columbia, Multnomah, Tillamook, and Washington County. So I am a resource person for you in all things infection prevention, but in particular COVID, and providing you with support as you go through this program. So I wanted to start and invite everyone who's on the call to provide us with an introduction to you. A big part of what we're trying to do here is really build connection. So if you would go ahead and put in the chat your name, your organization, so who are you with and where are you located, and what your role is. And then also, if you would share an icebreaker question with everyone. And the question that I would propose for you is, what is a favorite gift that you have ever given to somebody, and why was it special to you to give that gift? So if you want to go ahead and put your response into the chat, that would be awesome. And again, kind of mimic here what I've put in, that my name is Therese Finn, and I'm with Oregon Health Authority's HEI program. I'm the regional IP for Region 1. And then when we have some responses, then I will go ahead and answer the icebreaker first, and then see what everybody else has to say. So Christina, why don't you let me know when we're ready?
I see responses coming in, actually.
Yay!
All right. Would you like me to read some of them?
Sure. You know what? I'll go ahead and I'll do my icebreaker response.
Okay.
No, actually, because Christina started, let's go ahead and start with her.
Okay. So there is a Christina, DNS with Roseland Care Center, and her favorite gifts are plants, which is actually me too. So I think we're both the same, one and the same.
That's awesome.
All right. So we have Brenda here, RN Infection Prevention and Staff Development from Port Haven Healthcare Center. We have Susan, Linda Vista Prestige Care, LPN RCM. Mary Martin is here in the house, from OHA.
Hi,
So,
Mary.
Yeah.
Mary's our Region 2 IP.
Yeah. Correct. One of her favorite gifts, homemade gifts. Lots of love put into those. Nice. I'm curious on what kind of homemade gifts. And then Brenda, favorite gift given was to my daughter, and it was a trip to see all of the 48 states in a month. Wow.
Oh, that's amazing.
I would like that gift.
Yeah.
Susan says, my nephew gave me a homemade poem and picture before he passed.
Oh, isn't that meaningful? That's beautiful.
Yeah. Hello, Rosa. So there's Rosa. Also from OHA, I did infection control epidemiologist at OHA. So I did a holiday cookie extravaganza 1 year with some friends. We baked over 1,000 cookies.
Oh my gosh.
I admire that.
Yeah.
And then Shannon from Comagine Health, she gave my parents a trip to Nova Scotia for their 40th anniversary. They told so many stories about that trip. It really made my day that it meant so much to them. Love it.
Beautiful.
And then Heather Keisner, also from OHA, IPC manager. Favorite gift, puppy for my girls. Yes, puppies are always nice, aren't they?
love puppies.
Yeah.
Well, wonderful. So I'll share my favorite gift was a yellow umbrella for my daughter. when my kids were younger, my children are young adults now and launched and living their lives. But we used to watch almost every week How I Met Your Mother, and she was just fascinated with Yellow Umbrella. So I got her a yellow umbrella when she was in college, and she still uses it. And sometimes when it's pouring rain, and she kind of looks like this picture, which was lovely too, because when it rains, I kind of think about her with her yellow umbrella being protected from the drenching rain and having some sunshine and bright yellow around her. So yeah, gift giving is one of my favorite things too. Thinking about how much fun people have when we give them something meaningful. Okay, well, thank you everybody for contributing to that little bit of icebreaker. I think it's really helpful for us to get to know each other and make those connections. So for those of you who were, I don't know if everybody was able to participate in the original kickoff, and if you weren't, it might be helpful for me, for you to stick in the chat that you weren't able to, so we know really how to connect you to a lot of the information that was provided during that kickoff. But just in recap, so a big part of what this endeavor was, is to meet the challenge that has been identified related to infection prevention in the long-term care setting. So this program is called Advancing Infection Control Capacity and Education. We call it the ACE program. And it's a new initiative that is designed to support long-term care infection control specialists, ACE, in their certification in infection control, and really to build capacity for infection prevention and this preventing the spread of communicable diseases in the state of Oregon. So a little bit about the ACE program. This has been made possible through a collaboration between Oregon Health Authority's HAI program specifically, and Comagine Health, which has been amazing in really helping us deal with the logistics of putting a program together like this together. And the funding is really been provided by the Centers for Disease Control. Overall, our goal is really to expand statewide infection control capacity in long-term care by increasing expertise, infection control expertise in those settings through CIC certification. Our project aims, we've put together kind of 5 of them here. And the first is really number 1, to identify those with infection prevention and control responsibility in long-term care facilities, but also to connect with them and to build, find ways to build and strengthen the infection prevention community throughout the state. There's also study and coaching sessions that we will be beginning in January, and that's really, these sessions are designed really to specifically support the long-term care infection prevention specialists to take the CIC certification exam successfully. We're also distributing free infection control memberships specifically to APIC, the Association for Practitioners in Infection Control and Epidemiology, and resources so that you can all really engage in self-paced learning, which is very important in our busy lives, right? And then also to provide exam prep materials and costs for the CIC exam for those who are enrolled or participating in these study sessions. So there's a whole lot of free resources that come with this program. And I'll just be reiterating and sharing a little bit more of what we previously talked about those a little further on. Now, if you missed the original kickoff meeting, which was done by Dr. Rebecca Pierce earlier in the month, you can still listen to it. It's really absolutely loaded with valuable information about what the program is and sort of how to get your arms around it. And that link was just, I see Tiffany pasted it in our chat. So thank you for that, Tiffany. That's very helpful. And I strongly encourage you, if you've missed it, and I know a couple of you have said, Susan and Brenda, that you weren't able to attend. So we're trying, we know that you've all got a lot of responsibility and busy things to take care of at your facilities. But we're trying to make this as flexible and convenient for you to do in your own time as possible. So all sessions are recorded and will be available for viewing and reviewing at any time that you want to go through them again. Oh, so sorry. I'm sorry, I lost my screenshot here. Hang on a sec. So Christina, for some reason my screen dropped.
It might have minimized. So it could be in an upper corner or a smaller corner, but it might just be a smaller box. Or if you click on Zoom, where your menu bar is, you might be able to pop it up to the front.
Oh, this is weird. I apologize, everyone. I'm not sure what happened here. Okay, well, I've got a small screen. I'll work with this. Oh, maybe not. You know, you're probably going to have to take over advancing the slides for me because my view disappeared here.
That's totally fine. I can do that. I'm
Thank
happy to.
you.
Just let me know when you would like me to forward slides.
Yeah, go ahead to the next slide, please. So the purpose of these meet and greets is, number one, to make sure that you have the connection to the resources ahead of time, and also to introduce you to our informal office hour sessions. And what we're really wanting to do, and you can see by our Oregon map here that we have regions within the state that we're all assigned to, and that's me up in the upper left-hand corner, and the counties that I'm responsible for. And we want to be available to the IPs in our region, or really anywhere, who are looking for some additional support and resources for either for the study sessions themselves or to talk about the specific infection control challenges that you're having at your facility. And the meet and greets are really a way to let the you know who your regional IP is, make that connection. And we're also the ones that are doing the curriculum, going through the curriculum for the CIC study course. So these meet and greets and the office hour sessions are an opportunity to ask questions about this program in particular, but as we transition into more of our informal regular office hours, it's really to talk about what you're struggling with, either in the CIC prep or in your programs. Next slide, please. So I wanted to start with a little poll, sort of to get to know everybody on the call who are from our facilities and understand where you've been at with infection control. So our first polling question is, how long have you been working in infection prevention? And this is just a single choice question.
I think the first question is less than 6 months, though. Little typo, maybe.
Yes.
Thanks.
Thank you, Deb. Okay, so has everyone answered the poll at this point?
I'm so sorry.
Yeah, oh, interesting. I shared results already, but I believe so.
Oh, okay. So that's interesting. I didn't expect that. So essentially all of the respondents, everyone has said that they've been in infection control for more than 12 months. So that's awesome. You know, this CIC certification program really is a great next step for you with that, having that 12 months under your belt. So thank you for sharing that information. So let's go on to the next slide, Christina. Okay, so I wanted to just mention, you know, talk a little bit about me because we do want to make those connections. My personal passions are gardening. I honestly love being on my knees in the garden with my hands in the dirt, growing things. My husband and I also love to golf and travel golf while we're traveling. So that's a big part of our lives. As far as my professional practice goes, I've been a nurse, a registered nurse for almost 40 years. The majority of my bedside nursing experience was in the post-acute care, surgical critical care setting. And I've been in infection preventionist for almost 30 years, it'll be 30 years in January, and have had infection prevention experience in a wide variety of clinical care settings. Over the last couple of years in particular, I've really worked almost exclusively with COVID-19 outbreaks in the long-term care setting. So I've been really fortunate to have gotten a pretty good outsider's view still of some of the challenges related to infection control in the long-term care setting. And also been fortunate to have been able to do a fair bit of independent consulting in infection control throughout my career, particularly the latter half. So that's kind of where I'm coming from with my infection prevention background. Next slide, please. So for those of you who weren't, you know, who haven't really explored the content of this, there are 9 discrete components of these study sessions. The first one, the ones in green are the ones that I will be covering during the course of the sessions from January to around the end of July. Will be an introduction to the series, as well as some study tips for taking the CIC certification exam. I'll also be doing cleaning, disinfection and sterilization, as well as management and communication. So I'll cover those, what we call there's 8 domains that comprise the CIC certification exam. So those last 2 are distinct parts of those domains. And then the other ones will be covered by my peers: prevention and control, environment of care, surveillance and epidemiology, employee and occupational health, identification of infectious diseases, and education and research are those other components. Next slide, please. So before we sort of launch, I'm going to hand part of the presentation over to our Comagine partners for some of the logistics. But one of the other pieces that I'm interested in, we're interested in particularly, knowing that many of you have a year's experience or more in infection control. Our polling question is, what do you anticipate would be your greatest challenge in developing your infection prevention expertise? So the options, because we can't do free text here, single choice include finding time to study and learn, finding the right resources and materials, support from the team at my facility, not sure that I really want to focus on this, and lastly, being over my head, so to speak. So I'll wait for everybody to choose their response.
And also these are anonymous, so I just want to note that about all the polls that do come up on these.
These are what, Christine?
They're anonymous. So
Oh, yes.
They don't link back to anyone.
Oh, good. Thank you.
Yeah. Okay, we are at about 42%. So if there is more people that need more time, I'm happy to do that.
We'll give it maybe another few seconds and
All right.
okay, great. So about 67% of the responses were around finding time to study and learn. Yeah, that's, I think, probably was always the biggest challenge for me. Finding the right resources and material, that was about 17%. And boy, have we got a solution for you as far as resources and materials. And then support from the team at my facility, 17%. Yeah, that's really important. And those last two in particular are some of the components that we will be covering in that introduction and test taking tips that we'll be doing early on in the series that starts in January. So thank you for sharing those responses. Next slide, Christina. Okay, so again, for those of you who missed the initial kickoff, the study group and coaching sessions, you really should register for those in order to be able to access those materials. We have a QR codes for all of this to make it as easy for you as possible. I know we're also going to post the link in the chat if it's not already there, and you can use this QR code to register as well. You also need to complete the ACE program resource application and provide your contact information for your IEP specialist at your facility.
So Therese, this is Tom. Hey, how
Hey,
do we complete the ACE program resource application? I was having trouble finding that.
Okay, we're actually going to move forward through that. So that's going to be provided in the remainder, in the next couple of slides, actually.
Okay, great. Thank you.
Great. Good to know you're here, Tom. Thanks.
Yeah.
Okay. All right. So why don't you go ahead, Christina?
All right. Are you handing it to me?
Yes.
Is that what I meant? Okay. Okay. So I am going over what we're putting our resource library in. So it's called Padlet, and it can be accessed from your desktop or your cell phone or tablet. And you can follow this link or scan the QR code, which the link I believe is already shared in chat. Thank you very much, along with the study group and coaching sessions registration link if you do need that as well. But this is where we'll house a lot of the session recordings, any kind of resource links, any let's see, quick links, the contact information for any of the IPs or the Comagine team if you have questions on the resources and accessing them. And this is a secured website page, so you're only able to access it through this link. And then, of course, as I've stated, you can utilize it and access it through the QR code or the link that was shared in chat. And this will also be shared in a follow-up email as well. Okay.
So
and yeah, Tom.
Another question. Sorry, I have a lot of questions.
No, you're
Yeah.
totally fine.
Yeah, so I'm having a problem trying to decide what region because I'm the chief clinical officer and we have buildings all over the state. And so I always call Becca for everything because she's my resource for the state. So I don't know how to designate like my region because Becca and I talked and she's kind of my person I go to. So I don't know how to do that with you guys. What do you think?
Therese, would you have a question or an answer on that?
Well, I think that for you, Tom, it's probably important for you to talk to whoever you feel most comfortable with.
Okay.
And if you have a standard relationship with Becca that's worked, that's great.
Okay.
I would suggest that what you start to do is sort of disseminate this information down to the front line.
Already have.
Yeah, so that your region 1 folks know that they can reach out to me for information and resource.
Yep. Already have.
Is your corporate office in the Portland area?
No, it's in Vancouver, but we've got buildings all over Washington. We're one of the biggest providers. And so I've already disseminated all this information, encouraged folks to sign up for it. Like I've done everything I can and we've got some folks that are signing up. So I'm super excited about it. But
Yeah.
Becca encouraged me to do it. She knows we're located in Vancouver, but so that's why I was like, I'm a little off on where I should do it for my region. So, because I know when I register, I think you have to choose, don't you?
That was only for the meet and greets.
Oh, okay.
It doesn't apply for any of the study group and coaching sessions.
Okay.
But in all honesty, they can actually attend any of the meet and greets.
Okay.
We just separated them by region because of who's facilitating that meet and greet. But they're more than welcome to attend any of them.
Awesome. Thank you.
Perfect. Yeah.
Okay, back here. Okay. So this will answer your question, Tom, about accessing the ACE program resources. So Tiffany, thank you. She already put it in chat, the direct link for it, but you can also use this QR code. You'll complete this survey, and then you'll get access to the 1-year APIC membership in the national and local chapter, and then the infection prevention guide to long-term care. So I would give it at least about a month for all of the processing and to have the book shipped. And then just note that it was 1 APIC membership and text will be provided per ODHS licensed nursing facility, assisted living facility, or residential care facility. Okay. Tom, you're off mute again. Do you have another question?
No, sorry. I didn't have anything.
You just didn't mute.
I didn't mean to. I must have hit the button. Sorry about that.
No, you're totally fine. I mean, you can stay off mute if you want. All right, and then I'll give a couple seconds for this in case anyone needs to access the QR code or the link. All right. Okay, and then here I'll talk a little bit about a wonderful resource that you have access to. We wanted to introduce you to an innovative way to be able to bring IP education to your team members. Project First Line is a national collaborative led by the U.S. Centers for Disease Control and Prevention, so this is also known as CDC, to provide infection control training and education to frontline healthcare workers and public health personnel. It was developed to address long-standing gaps in IC infection control knowledge and practice in healthcare settings nationwide, which were highlighted most recently as a result of the COVID-19 pandemic. And then Tiffany, so kindly put a link in chat for you. We know that sometimes it's difficult for direct care staff to step away from their work to join a training, and staffing challenges continue for many settings. We want to introduce this innovative way to bring education right to the fingertips of your teams. So once a week on Tuesdays, our Project First Line text campaign will bring you tips, video links, infection control, infection prevention factoids, all conveniently to your smartphone. Additionally, it directs you to the CDC Train site, where some disciplines can acquire a CE for watching the brief videos online. And then we also have flyers available on our website. And we also have posters actually available as well if you would like to post them up in your break room hallways, wherever your staff will see them.
Now, Christine, that texting campaign actually starts next week, doesn't it?
It does. It does
Yeah,
start
so
next
I know
week.
I've signed up quite a while ago. I haven't heard anything, but I'm eagerly waiting to see what starts on Tuesday. So
Yeah, and we started it specifically for next week with an International Infection Prevention Week, Infection Control Week. I
yes.
believe I don't know the exact words on that, but yes. And Shannon asked a question to everyone in here today. Have folks heard about Project First Line, or is anyone currently using the materials? We'd love to know. So feel free to put that in chat or take yourselves off mute, whatever's comfortable for you.
Christina, this is Shannon. I'll just chime in that I know we've been doing a text campaign in some of our other states that we work in.
Mhm.
And it's kind of nice if you're the person in charge of doing infection prevention at your building and you're looking for ways to educate people on things, especially if they're maybe just needing to know infection prevention basics, without necessarily diving into some of the specific clinical things that you might be teaching nursing or some other direct care staff. But it's, again, really intended to be simple, accessible for any worker, and the fact that it's all nicely packaged and there's lots of different things you can kind of work with and different materials all ready for you, I think makes things a little bit easier if you're the one in the position of trying to educate your staff. You don't have to start from ground zero to do that. So.
Tom, was it an accident again?
Well,
I saw you
was
off mute,
gonna
but I
ask
wasn't
if I
sure.
could- how do I get this poster? Because that would love to put this in my facilities.
Okay, I will work on that. Actually, if you can connect with me, I can help with that.
Okay.
Yeah, and Christina, if I can kind of weigh in, we have PDFs available right now of these, so you could print them off in an 8x11 right at the moment, and we're working on ordering larger size posters and figuring out the distribution of that. So I believe I'll find the PDF link and drop it in chat where you could just go ahead and
Oh, love it. Thank you.
Yeah.
Yeah, get this all over my buildings. So that'd be
Awesome.
great. Yeah.
Thanks, Shannon.
Super.
All right. Okay, I'm going to hand it back to you, Therese. This is the contact us. I don't know if you want to go over this or if you want me to.
No, I'm happy to. Yeah, so having a contact number for each of the regional 1 IPs as we go through these meet and greet sessions will provide our individual information. But for me, you can reach me at my phone number, which is here, as well as my email. And maybe Christina or Shannon, someone could drop that in the text box. Tiffany, whoever's doing the texting. In the chat box. And then for Comagine Health, Christina is got her email here, as well as a shared email box for general questions that you can use, and a main website learning page.